A new analysis of medical data from around the world indicates that 1.3 billion people could be living with diabetes by 2050, and that 50% of those cases could be caused by obesity. There's some new research on drugs used for obesity that are typically injected that may be made available in pill form sometime in the future. ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, joins me now for more on this. Dr. Patel, thank you so much for joining us.
Morning, Mona. Happy to be here as always, but not to talk about this heartbreaking topic.
Let's start with the new numbers about diabetes. What stands out to you about these numbers?
What stands out to me, Mona, is that this has been increasing over time. And so this is not really a big surprise, but to see that number that potentially over 1 billion people will have diabetes, which is preventable by the year 2050, is staggering. And what's really concerning is that this data was looked at in over 200 countries with numbers before COVID-19. So they may be worse now. We know that this is mostly type 2 diabetes. About 50% is estimated to be related to obesity and potentially linked to sedentary lifestyles and consumption of ultra-processed foods. And it's important to note that diabetes can lead to really serious complications like heart disease and stroke. So not only in terms of treatment, we really have to be focusing on prevention, not only locally, but globally.
And Dr. Patel, drugs used for obesity and diabetes are helping many people lose weight, but often require weekly injections, at least for now. A new study showed that a pill version of the active ingredient in drugs like Ozempic was also effective. What should we know about that?
What we should know is the first off the bat is that this would be a daily oral pill form versus a weekly shot, which some people may prefer that. So this data did show that over 68 weeks, in groups that lost at least 5% of their body fat, 85% were taking this oral form of semaglutide versus about 26% who were taking placebo. So those are important numbers. And this was a study done in overweight and obese adults. And overall, people taking this medication lowered their BMI by 15.1%, minimal side effects. But again, it's important to note that this is a treatment. This is a kind of a treatment or looking at people who are already obese. And we still have to be looking at, yes, treatment, but also how do we prevent them from getting in this situation?
All right, those numbers hopefully will serve as a wake-up call for all of us. And Dr. Alok Patel, thank you so much for joining us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.